Welcome to the Aid Market Podcast, where foreign aid partners connect to learn about key funding trends and market insight. The podcast is co-hosted by Aid Connect Data, the pipeline and market intel software for USAID partnering, and Connected International, the leading USAID partnering support consulting firm. Now, here's your host, Mike Shanley.
Hello, everyone, and welcome to the Aid Market Podcast. Today, we are very excited to have Ashley Frost, the Deputy Director of the Office of HIV AIDS at USAID, and James Maloney, the Deputy Director of the Office of HIV AIDS at USAID, on as our guests. We're going to be discussing global health, USAID's work in PEPFAR, and the important activities that their colleagues are doing around the world. However, to get started and frame the discussion, I wanted to share some key talking points thanks to USGLC on PEPFARs and the important accomplishments that PEPFAR has achieved over the last 20 years. As many of you know, this is the 20th anniversary of the U.S. President's emergency plan for AIDS relief. PEPFAR has delivered unprecedented impact in the global fight against HIV AIDS. Since its inception, it has invested nearly $100 billion in the global HIV AIDS response, the largest commitment by any nation to address a single disease in history. PEPFAR's success is due in large part to its focus on accountability, transparency, impact, and equity. This drives constant programmatic improvements and efficiencies, which have allowed for key expansion of life-saving treatment to more than 25 million people. Some key stats from PEPFAR: saving lives. PEPFAR has saved an estimated 25 million lives and accelerated progress towards controlling the global HIV/AIDS pandemic in more than 50 countries. PEPFAR has resulted in 5.5 billion babies born HIV-free, ensuring children around the world can live healthy and prosperous lives. PEPFAR has helped train 340,000 healthcare workers to deliver and improve HIV care and other health services. And PEPFAR has consistently received broad bipartisan support in Congress, having been funded by 10 U.S. Congresses and implemented by 4 U.S. presidential administrations. USGLC has a lot more information on this, some great quotes supporting it from President George Bush, President Joe Biden, from Senator Chris Coons, a Democrat, from Senator Lindsey Graham, a Republican. So very strong bipartisan support. And with that, there'll be more information in the show notes, but let's get right to our guests. Again, Ashley and James, thank you so much for joining us today. Ashley, if we could start with you, could you share with our audience a little bit about what is your role at USAID?
Yeah, thank you, Mike. Thank you so much for this wonderful opportunity, and good morning, good afternoon to all of our attendees. It is wonderful to be here. I serve as one of the 2 deputy directors for the Office of HIV/AIDS here at USAID Washington. I am a foreign service officer. I've been supporting PEPFAR programs for a decade at our missions around the world, and I'm just so pleased to be able to be here and to support our more than 50 country-led HIV programs that we implement through our PEPFAR resources.
Great, thank you so much. And we'll get into some more detail on those programs. James, could you also share a bit about your role at USAID?
Sure, and thanks, Mike, for having Ashley and I. And it's great to be on with you and your listeners on this podcast. As Ashley noted, I'm the other deputy. We're 2 deputies in the Office of HIV/AIDS, where we've got a big team, over 300. And so we split and really work together to provide leadership to the team here that's based in Washington, but supports over 50 countries that are implementing the PEPFAR program with USAID's support. And so I've got oversight of our divisions that lead our prevention, care, and treatment work, our supply chain investments, and our strategic coordination and communication, especially with the other multi-lat institutions that we work with. So thanks for having us. Happy to dig into the conversation today.
Excellent. Well, James, let's stick with you for a bit and get into some more detail. Could you share some more detail on the breadth of USAID's work in global health and supply chain and the work your team does supporting the PEPFAR initiative?
Sure. Well, so Ashley and I are both in the Office of HIV/AIDS, which is the part leading within the Bureau our PEPFAR implementation and our work on HIV, but we both had experience whether it's been overseas or in other roles or duties as assigned, certainly during the COVID pandemic, that have touched on our other work as a bureau. And so the Bureau of Global Health, gets various funding streams from Congress. We've got funding for maternal child health, family planning, reproductive health, HIV, malaria, nutrition. And so it's a broad set of funding sources that come to USAID for implementation to advance our global health goals. A couple things tie those investments together that I wanted to highlight just as bureau-wide goals for USAID. One is really the investments we make at the primary healthcare level, and really thinking about kind of at the lowest level of countries' health systems, what are we doing to support access to healthcare in all of those individual funding streams, but they can really come together at a country level and in partnership with governments and other country stakeholders to improve health at kind of that primary level. Oftentimes it's hospitals and building new infrastructure that might get a ribbon cutting, but in terms of the buying the best health outcome with our investments from the U.S. taxpayers, it's really those investments we make at a primary care level that are going to have the most impact in terms of health outcomes, saving lives and supporting healthy lives. And so our investment, that's one of the unifying things across the Bureau that pulls us all together, is those investments at the primary care level. It also means investing in the health workforce at those levels. So not just clinicians and doctors, but nurses and the community health workers that are kind of extending the reach of the health work beyond just the walls of a health facility and out into the communities. And then maybe, Mike, just to say the second thing that I think is so important that drives a lot of our investments across individual disease or health areas is health security. And really coming out of the COVID pandemic, applying lessons learned there, but also investing now in the health systems, both in country, regionally, and globally, that are going to make us better prepared and more resilient to inevitably whatever the next either infectious disease may be or other shock. And sometimes those shocks are caused by climate, whether it's a cyclone or a hurricane or a natural disaster that happens. And sometimes those shocks can be political. We're in terms of wars or other conflict or other political issues that can affect the health of folks living within any geography in any country. And so those are the other investments we make, I think, as a bureau, is really in the health systems that both underpin our HIV response, but also help with our broader health security as a global community.
Thanks a lot, James, for setting that broad context. Ashley, do you want to get into a little bit more detail on USAID's role with PEPFAR, some of the successes that you've seen over the years, and kind of dig into that topic? Thank you.
Pleasure. So thank you, Mike, for that opportunity. USAID is one of 7 agencies affiliated with PEPFAR. We are one of the largest implementing agencies that implement PEPFAR programming. With regard to our successes, I think it really is just an honor and a privilege to work with this program, given what it has been able to achieve over the last 20 years. It really is groundbreaking work and unprecedented within public health. To just draw your attention to a couple of achievements that I'd like to celebrate with regard to our research portfolio. I don't know if people are aware of this, but USAID is actually a leading donor. We're 4th largest donor in the HIV vaccine space. We recently awarded a new award to a local implementing agency, a local implementing partner led by SAMRC in South Africa. So it's our first local award in HIV vaccine space, leading a consortium of partners on the continent to advance our understanding and knowledge of HIV vaccine research and work. And we're also doing a lot of end user work. We have to make sure we're developing biomedical prevention products that people want to use, that are going to be easily scalable, and that we have all the information that we need from an end user to make sure those products are well received. We've got a catalyst study that our Mosaic partnership is implementing right now that's looking at women's options around HIV prevention including long-acting cabotegravir injections, the PrEP ring, and also oral PrEP. So those are just a couple of things on the research side we're excited about. Right now, we're doing a lot of work with regard to HIV sustainability. We are partnering with our colleagues at State Department and the Bureau for Global Health Security and Diplomacy, as well as our interagency partners in PEPFAR, to advance the conversation in partnership with UNAIDS around sustainability. And USAID has a lot to offer in this space because we lead with regard to private sector engagement and healthcare financing. We understand at USAID that we must understand that larger ecosystem of how a health program is sustained in a country and promote local leadership to make sure that moving forward, PEPFAR transitions in a way and transforms in a way that we can absolutely elevate our local counterparts as much as possible. I know, let me hand it to James because I know he's got a lot of other successes he'd love to add to that as well.
Well, I mean, Ashley, thanks. And Mike, you really started with it at the beginning. 25 million lives saved. Over 20 million people at this point on treatment. And that's a tremendous success in and of itself. I think if you look at what the over the last even 10 years of PEPFAR, we're celebrating the 20th year last year and just into the 21st year this year. But if you look at the funding that's been available, it's actually been in nominal terms fairly steady over the past 10 plus years. But yet the programs continued to grow. And that's been done as a result of both just a focus on the science of investing in what is most effective, continually evolving, and also driving efficiencies in our programming. When the program started, treatment for an individual for HIV cost over $1,000 a year. And it's through the USAID investments in our partnership with other donors like the Global Fund, which we've been able to shape that market, bring better drugs actually to the market, but also drive down those costs. And so now it's less than or just about $50 a year for a person to be on treatment for a year and for their life. And so anyhow, those are some of the key successes. I think that we've, just stepping back a little bit and reflecting over the last 20 years, there's been tremendous investment from the U.S. government, the U.S. taxpayer, into this response. But it's also been, as Ashley noted, our work across the interagency, the U.S. government effort to implement it, and constantly push ourselves to do more with the resources we've been entrusted with, to make sure we're reaching those most at risk. And there are those that we still need to work harder to reach, that were not yet diagnosed with HIV, as an example, or on treatment. And so we're constantly looking to how do we accelerate that work? How do we work with key populations and those that are going to have the most difficulty accessing the health system? Our investments, for example, in adolescent girls and young women, knowing that they face increased risk for HIV acquisition. We've been investing in the services that support prevention of HIV in that population in particular, looking at education support, completion of primary and secondary school, and then in addition to just the health investments themselves, kind of the social and economic support resources that surround an individual and are really critical for their lifelong success and the economy.
Thanks a lot for sharing all that, just all the important reasons to continue funding this important initiative and the important work being done here. I want to focus on localization for a bit. You specifically talked about the award to the local organization in South Africa for the vaccine work. Could you talk a little bit more about that, especially given how important localization is across all sectors of international aid and with USAID? Talk a little bit about how PEPFAR was so successful engaging with local actors, and maybe even just any recommendations or advice you'd have for your colleagues in and outside of USAID and other donors working on localization, on how they can effectively engage local partners. And it'd be great to hear too, what does that mean, localization and local partners, to you? Because I think even just the definition of that is an important conversation as well. So I know, Ashley, do you want to share some thoughts on that? And then maybe James?
Would love to. Thanks, Mike. I'm glad we're talking about this topic that's so dear and near to my heart. With regard to localization, the Office of HIV/AIDS and the Global Health Bureau we have really been the front runners in the agency and been able to guide our agency in these spaces. Within PEPFAR, we have actually transitioned about $400 million of our annual resources to local partners since 2018. So right now, about 58% of our resources are implemented through local entities, and we've diversified those set of partners. So we've transitioned from about 111 local entities and partners to 175. And you asked how we've been able to do that. It's really through our country-led programming, the relationships that our country-led staff have as senior diplomats in their countries and senior technical leaders of U.S. government programming, to make sure that we are spending the time to grow the local organizations that we know that are so important to sustainability of HIV response in each individual country. So we're very proud of that work. And in fact, right now, just looking at our FY23 results, about 75% of our care and treatment portfolios, so about 5 million individuals who are supported with antiretroviral treatment through USAID, are supported through local partners. I do want to say that for us, it is not an either or. Expanding our work to local partners is really about diversifying the set of partners that we're working with. Small business engagement in the U.S. is also really important. Small businesses have a lot to offer to the work we can accomplish together. Our larger international partners have specific skill sets that we cannot live without. So I really just want to encourage everybody, as we talk about localization, to think outside of the box about what does that mean for the purpose of sustainability and letting countries and supporting countries to lead their HIV response into the future, and how, with all of the diverse skill sets that our diverse set of partners hold, can we each contribute to that larger agenda.
Ashley, such important points there. The thing I wanted to pick up on is just your concept of it's not a one size fits all, right, approach. And obviously we've done a lot, I think, and been very committed as USAID to advance direct funding to local partners as part of our effort, not just to sustain the response, but also to accelerate the work and the gaps we have to close. Often the partners at a local level are the closest to the community and know that community the best in terms of how to reach those that we're still trying to reach. At the same time, we wouldn't be where we were or are today without the richness of the type of organizations we've partnered with, both internationally, whether they've been private sector partners. I'm thinking of logistics firms from around the world, whether they've been faith-based partners, and really working through the religious communities in various countries that are a very important part of people's lives and reaching them with health services, whether they've been the local NGOs or the international NGOs, or government institutions and regional institutions that are very critical to just sustaining the response. So I think when we talk about localization, funding is an important piece of it, but it's not just local NGOs. It's that whole ecosystem that we see coming together. But it's also how we do the planning. It's not just about the money. It's about how we're engaging each year in terms of our planning cycle with the country and the local actors. Civil society has been so important to the HIV response globally, both here in the US domestically, but also the reason why we've had such longevity and success globally is a very active civil society in the HIV space. And I think we have to call that out and thank them. They also hold us accountable. They push us each year to make sure we're reaching those that we haven't reached. And so we intentionally involve both global and local civil society in the planning. Just to say, it goes beyond just funding. When we think about localization, it's also about how we are engaging them, whether it's in the planning phase or actually in the monitoring phase, and including community in the kind of monitoring of the programs we do, and that kind of cycle of feedback to shape our work.
I appreciate that point, James. Sometimes what comes up in the conversation is localization is building capacity of local partners to work with USAID, but it's actually being aware of what is the capacity that's already out there and strategically engaging with it. So I think that's a great point. Great. We talked a lot about the important success you and your colleagues have achieved over the last 2 decades. Let's start looking forward. What are you looking at for the priorities for 2024? And what are the things that are still left to be achieved in this space? I don't know, Ashley, do you want to start with some thoughts there?
I would love to hand that to James to kick us off.
James, would you like to start with some thoughts
Sure.
there?
Well, I know we're both passionate about this, and I'm actually really excited for 2024. I think the top goal for us really is by the end of 2025. So we've got 2 years, really, this calendar year and the next, to help countries reach the global commitment to reach what we call the 95 goals. So 95% of those that have HIV know their status, 95% of those are on treatment, and 95% of those are virally suppressed. We're not there in terms of all countries, but we want over the next 2 years to get as many countries to that kind of status as possible. And so that is very much the kind of all hands on deck from 50 plus countries we work across to help move countries in that way. At the same time, this year, we're going to be working with countries thinking even longer term towards 2030. What do we do to help countries help sustain the HIV response, to keep the results that are here with us today, knowing where we'd like to accelerate to get to 2025, but how do we position the countries to be able to continue that, both prevention, care and treatment, provision of critical HIV services beyond 2030. And so it's not an either or, right? We're both accelerating to close the existing gaps over the next 2 years, but also planning in terms of how we do that to sustain the response. Probably about a year and a half ago, the agency, or USAID, we released something called our Approach to HIV and Optimized Programming. And it really laid out 5 key pathways that we think are critical to helping PEPFAR deliver on its 5-year strategy. And so I'll run quickly through those and then happy to turn over to Ashley for additional thoughts. But the first pathway is really, we're at a point now, and I mentioned this earlier, we have better drugs, we have better products, both in the prevention and treatment space for HIV. We're at a point where we really ought to be simplifying our service delivery model and integrating really intentionally the way people receive their HIV services into the way they receive whatever their health needs may be. And so taking a very client-specific and holistic view, and again, linking it back to, if they're able to access care at a primary care level, that is a sustainable way for us to continue to provide those critical prevention and treatment services. The second pathway is really a focus on adolescents and youth. We know we have to continue to drive down new HIV infections if we want to be successful in sustaining the HIV response. And the youth are really critical to reach. It is not the case anymore that you see the coffins lining the street in many of the countries of sub-Saharan Africa that you did 20 years ago. And so just making sure that there's that awareness of HIV, especially with the youth that still remain at risk and still need those investments in terms of their own health resilience. That is a critical piece in terms of our continued reduction of HIV new infections. We've already talked on the third pathway, which is really about enabling this locally led and managed HIV response, that it's that full continuum of both government, public, and private sector, both for-profit and not-for-profit, that are going to be critical to that resilient response. The fourth pathway, and there's some exciting things happening this year in terms of our work as USAID in the supply chain space, but really driving a person-centered supply chain solution, which we have to continue to make sure the product and health commodities which the programs rely on continue to be of quality, affordable, and available at the right time where clients and patients need them. And then the fifth pathway for us as an agency is really thinking through how we're positioning the health systems to both be ready and resilient to future shocks. And again, we talked about those earlier. COVID was a shock for us. It actually caused some programs to pause. Some of our prevention programs we had to pause. But at the same time, we were able to adapt others and expand, for example, innovations like multi-month or decentralized drug distribution, so clients could get their drugs easily and not have to go into a health facility as often and expose themselves to potential risk of COVID. So anyhow, those are in a nutshell the way we're looking at the year. So many exciting things to happen, but I'd say those 5 pathways kind of guide our investment.
Thanks a lot, James, for setting that framework. Ashley, anything else you want to add on that, or we're wrapping up in a little bit? Any other points you want to make sure to share with our audience?
James did such a nice job of outlining our priorities. I think the last thing I would like to share is just how important the dialogue and communication and collaboration is with both our government counterparts, our country teams, and our implementing partners, and how much I appreciate that lively, candid discussion, especially from implementing partners, and how having that feedback can really help inform our strategy in a very productive and strong way. So I just want to recognize people for that collaboration and partnership, and know that we appreciate the engagement and dialogue and learning from everyone that is working around the world to support and advance PEPFAR programming. And I look forward to that continuing.
Great. And Ashley, anything else you want to share on that, or what are some of those effective or productive ways to share insight from the implementing partners, from the government entities? Is it presenting at conferences or hosting their own efforts, or communicating with your colleagues directly? What are some of the effective ways you've seen to have that productive communication?
I would say yes to all of the above that you listed. Being a Foreign Service officer who has served in missions for the last decade and just returned to Washington, I'm just so impressed with how our PEPFAR implementing partners are really thought leaders in this space. So public engagements that we are participate in jointly, webinars, conferences, all of those things, working closely with AOR/CORs for awards that exist, having that collaborative partnership and sharing of ideas. And then really the importance, as we're making our programs more efficient and effective, openness to working with others and collaboration across partners is even really more important. We don't consider that we have all of the answers. So in any way that we can receive the feedback and great ideas of our implementing partners, we're receptive to that.
Great, thank you. And then we'll wrap up in a bit here. James, anything else you want to add first?
I would just, Ashley said it so well. I think, in terms of, and I know we've got some of your followers are from the implementing partner community. One thing we didn't touch on, which I think is critical for this year, is that we continue it's PEPFAR reauthorization, right? We'd like to see a 5-year reauthorization of PEPFAR, and the continuity of what, as you noted at the top, has been bipartisan across administration support of this program. And I think we're at a phase in which we're really close to achieving many of the goals we have and ending HIV as a public health threat by 2030. But I think we rely on our partner community to help tell the good story. As you noted, even many of the names you were noting, there's a lot in Congress now that were not around 20 years ago when PEPFAR started. And so I think we have to continue to make sure that everybody understands the work that we've done, and our implementing partner community can be part of telling that story. They're part of not only just the innovation that continues us to be able to succeed in the program, but also communicating that in a way that I think resonates with all the stakeholders, whether they're in Congress or the U.S. Taxpayer or others. And so I think that's one ask I have of your followers, is to help us continue to engage in that dialogue, both in sharing the success and the good work that we're doing, but also the work that remains. Obviously, our partners are stewards and safeguards of U.S. government money and follow all the rules and regulations that go along with it. But at the same time, I just wanted to note, I know it seem at times that USAID is a huge thing and a beast, and these $1 billion or $1 million awards, but we also make small awards with new partners, and that's been an important story about driving that innovation. And so whether it's local partners or, as Ashley noted, small businesses, we're constantly looking for that innovation in the program, which is going to help us do more and do better. And I'll just share one anecdote. One of our largest treatment partners today, which is a local partner in South Africa, actually started as a high-risk grant almost 20 years ago, right? So it started from the amounts of just 100,000 or a few 100,000, and over the years it's grown into a partner that's now managing millions and has millions of people on treatment. And so I just think that's a success story. It's an example of what we mean when we talk about localization, but it's just we are still looking for that. We are still looking for that engagement with our implementing partner base and organizations and new organizations.
Great anecdote, James. Thank you. Ashley, give you the last word to wrap it up. What's the best, any key resources to direct our audience to, or the best way to connect with your team?
I think the place to start will be in the show notes with the strategy that James outlined, the AHOP strategy.
Excellent. Great. Well, Ashley and James, thank you so much first for the important work that you and your colleagues do around the world, as well as for taking a little bit of time today to share this important message. We're happy just to be a platform to further amplify the important work you all are doing. So thank you all very much, and all the best with your important work in 2024.
Thanks. Thanks so much for having us.
Thank you so much, Mike. Appreciate the opportunity.
Great day. Bye.
Thank you for tuning in to the Aid Market Podcast. If you enjoyed today's show, be sure to subscribe wherever you get your podcasts and connect with Mike Shanley on LinkedIn to stay updated on the latest USAID funding trends.